In order for you to understand chiropractic, it's necessary that we first explain a little anatomy to you. The spine consists of 33 bones called vertebrae that are stacked vertically one upon another. This framework provides strong yet flexible support for the trunk of the body, as well as protection for the delicate spinal cord housed within it. The vertebrae are connected by facet joints at the back of the spine, and these joints allow movement between the bones of the spine. The vertebrae are stabilized by ligaments and, most importantly, are separated by intervertebral discs between each vertebra, which functions as a shock absorber. The vertebra can be classified into 5 segments. These segments include 7 cervical vertebrae, 12 thoracic vertebrae, 5 lumbar vertebrae, 5 fused sacral vertebrae, and 4 fused coccygeal vertebrae. The spinal cord runs through a canal located at the back of the vertebrae and extends from the brainstem to the lumbar region of the spine. Nerves branch out from the spinal cord, sending messages for movement and body function to the rest of the body. The anatomical shape of the adult spine contains 4 basic curvatures. The thoracic and sacral regions are curved towards the back, while the cervical and lumbar regions are curved forward. This unique shape of the spine allows it to support the weight of the human body. So what is chiropractic? Chiropractic is the largest natural healing profession in the world. Chiropractors believe that it is normal for you to be healthy, and chiropractic emphasizes the inherent ability of the body to heal itself in most cases. Chiropractic is based on the premise that good health depends in part upon a normal functioning nervous system. You need to know that all bodily functions are controlled by your nervous system. Even your ability to heal depends upon a healthy nervous system. The brain sits on top, taking care of the body, controlling and coordinating every function. Nerve impulses continue out the spinal nerves to all of the organs, tissues, and systems of the body. It's much like an electrical system. If it becomes short-circuited, the nerve flow becomes altered, and the brain is not able to properly communicate to the involved part of the body. This will reduce bodily function, and pain and disease follow. The most common problem occurs when the spine becomes misaligned or loses its normal function. Notice how the nerve is affected when the vertebra becomes misaligned. Misaligned vertebrae are most commonly a result of either injuries or poor habits, such as how you sleep, sit, or stand. The chiropractic approach to better health is to locate and help remove these spinal problems which interfere with your natural state of well-being, while avoiding drugs or surgery when possible. We do this by adjusting the spine to restore proper joint and spinal mechanics. Watch how the nerve recovers when the misaligned vertebra is corrected. Please understand that the actual process is much more involved, but I hope this works as a simple demonstration. So what is an adjustment? The most common therapeutic procedure performed by doctors of chiropractic is known as spinal manipulation, or also known as a chiropractic adjustment. The purpose of manipulation is to gradually restore joint mobility by manually applying a controlled force into joints that have become hypermobile or restricted in their movement. This alleviates pain and muscle tightness while allowing tissues to heal. When the spinal irritation is gone, the nervous system can function properly, which is essential for the overall health of the individual. So what is that popping sound that you might hear during an adjustment? Research has shown that small pockets of air or bubbles are found in the tissue fluid surrounding a joint capsule. During the adjustment, the part of the spine being treated undergoes quick and gentle stretching of the spinal joint, and when these joints are stretched, the pockets of air pop creating a cracking sound. But there's really nothing actually breaking or cracking. Does chiropractic treatment hurt? A chiropractic adjustment rarely causes discomfort. However, some patients may sometimes experience mild soreness or aching following the first treatment, the same as you might experience with some forms of exercise that usually resolve within a day or two. What about drugs or surgery? Chiropractors look at drugs and surgery as a last resort, not the initial approach to healing. Why frequent visits are required in the beginning? Remember, your problem didn't happen overnight. In order to make significant long-term changes, frequent treatments are required for the first few weeks. An orthodontist can put your teeth in braces to make changes, but since it's unwise to put your spine in a brace, we require repetition to get your body to cooperate. So what is wellness care? Once your original problem has resolved, we suggest that you continue with a wellness schedule so that we can maintain the success you've attained. You see, we can't keep you from getting older, but we can try to make the aging process easier, and we call that graceful aging. Thanks for watching. Hopefully, we've answered some of the questions you might have had, and we welcome your comments and suggestions.